I would like to start the webinar. My name is Sadaf Lyons. I'm the Director of Collaborative Surveillance, Workforce and Health Emergencies at IANPHI, and I welcome you to the webinar. I will be moderating this session. Just a couple of housekeeping rules before we start. This session will be recorded, and if you could please mute your microphone during the presentations and use the chat facility for any questions that you might have. We will be keeping an eye on those questions, and during the panel discussions, we will make sure that your questions are addressed, or through the chat itself if we don't have time. Also, we welcome you to joining us today, and I know it's very close to the winter break, but we really wanted to host this webinar on this very important subject regarding community protection and what the role of national public health institutes are to operationalize a very community-centered preparedness, response and resilience for public health emergencies. We have a fantastic lineup of speakers today. Raphael, if I could have the next slide. So we are going to start with opening comments from Nedret Imologlu, who's the director. The last slide, please, the one before, who is the Director for Country Readiness Strengthening for Emergencies at the World Health Organization, followed by Professor Duncan Selby, who is the President of IANPHI. Other speakers for today are Kai von Harbu, who is the unit head from the WHO's Country Readiness and Resilience Unit, Dalia Zaid, who's the Chief Health Policy Officer from the Jordan Center for Disease Control, Zainab Alwaish, who's the Public Health Advisor from the Institute, and Edmund Newman, who's the Director of the UK Public Health Rapid Support Team. The panel discussion will be facilitated by Dr. Quang Rim, who's the team lead for the Community Public Health and Service Delivery Community Readiness and Resilience Unit at the World Health Organization. Next slide, please. So this is the agenda of the sessions that we're going to have today. As you can see, we've got some really good sessions lined up and presentations. So without further ado, I am going to invite Professor Duncan Selby to open with his opening remarks on behalf of IANPHI. Duncan.
Hi, good morning, good afternoon, good evening, everyone. Duncan Selby, I'm the President of IANPHI. As the former Chief Executive of Public Health England, I'm currently in the Kingdom of Saudi Arabia, helping and supporting the new Public Health Authority here. IANPHI, I think everybody knows, is the world's gathering of the leaders of national public health institutes, agencies and authorities, all part of their government. It's a peer-to-peer network. And we exist to support and strengthen public health infrastructure around the world. National Public Health Institutes in many parts of the world as part of that. And where possible and where people are wanting to develop the public health infrastructure, we are there to help and support them with this. In October 2022, Dr. Tedros and IANPHI signed an agreement to work together in a number of areas, in particular in operationalizing the essential public health functions. Today is a really important part of that, and to work on APRRs, particularly around the Global Health Emergency Core, strengthening surveillance and critically strengthening workforce development, competency-based training for workforce development. And if we learn anything from the pandemic, we learned about the importance of preparedness and investing in preparedness. Outbreaks almost always begin in communities. And this framework that we're discussing today is about how to, if you like, strengthen the National Public Health Institute contribution, community involvement in not only in how these affect and impact on communities, but how we engage and involve communities throughout. Crucially, again, the importance of getting the workforce right and supported in this. So I'm very glad that we've got this workshop to see how we would operationalize this framework in a highly pragmatic way. And I look forward to the questions and answers and taking this work forward. Thank you. Sadaf, back to you.
Thank you very much, Duncan. And now I'd like to hand over to Nedret for her opening comments on behalf of the WHO. Nedret, please. Nedret, your audio's off, your mic's off. Can't hear you. No, we can't hear you. Your audio is showing as though it's off. Oh, now it should be okay.
Okay. So good morning, good afternoon, and good evening to you all. And I'd like to start by thanking you for joining us at this webinar that we jointly organized with our great partner, the National Public Health Agencies, in implementing the community protection. And I'm really glad to see Duncan and Sadaf with us. And this has been a long partnership, not only on the community protection. We have been working very closely on a number of areas to be able to support the national efforts to develop the strategies, the plan, the capacities, which are critical for strengthening a country's ability to prevent, detect, and respond to health emergencies. So thank you very much, Sadaf and Duncan, for making this happen. And we are committed to continue working with the IANPHI strongly, also on other areas which are equally important on being able to operationalize the community protection, like the early detection capacity, the surveillance, the laboratories, the health workforce, the community-based implementation of interventions, and engaging the local authorities and all the players, stakeholders, including the civil society. So I'm really happy that you're organizing this webinar today. It is going to deep dive into one of the 5 capabilities that we identify in the strategic direction within the health emergency prevention, preparedness, response, and resilience, which is shortly called HEPR. And community protection and resilience is recognized more and more as a critical element to be able to bring all these national capacities to the community level, to be able to engage, empower, work together with the communities, all multi-sectorial, whole of society approach, as well as engaging all the stakeholders, as I mentioned, the civil society being one of the critical ones. And as the leading public health authorities in their respective countries, the national public health agencies are the keystone in implementation of those capabilities, all the 5 capabilities defined within the HEPR framework. And it is critical for, again, the national public health agencies to support the national efforts to mainstream community protection into public health systems, as well as the emergency management policies, programs, practices, through the clearly defined roles and responsibilities within the national public health emergency coordination and management systems. So this work could achieve success only with a broad partnership. So let me mention 2 other major players together with us, with IANPHI, is WHO and UNICEF and IFRC, we have developed the concept for the community protection together, which you will hear soon. And I'm grateful to those agencies, particularly UNICEF, IFRC, with the also the initiative of collective services, which allowed us to be able to get down to the communities, try to understand their needs, and at the same time to be able to respond efficiently and timely in an emergency. So we have already started implementing the community protection in close collaboration with partners, as I mentioned. And if you allow me, I would like to mention a few more partners who are really supporting us, like the community readiness simulation exercise and the action planning, which is going to be critically important to have some tools and models for the countries to be able to implement, that we have conducted jointly with UK as well as Germany, RKI. I'm really grateful to both the countries and the institutions for their help in supporting us in operationalization, as well as CDC, that we work together. And I'm sure we are going to broaden and we are eager to broaden that partnership. And we are ready to work together to be able to support the communities, to be able to be ready to respond effectively. So I really look forward to the panel discussion, and I think it's going to be a good way for us to guide our future work. Thank you very much, and back to you, Sadaf.
Thank you, and thank you so much, Nedret and Duncan, for your opening remarks. And we're very fortunate, I think, to have such leadership to guide us and recognize the roles and functions that National Public Health Institutes play in the public health system, especially in terms of creating a resilient health systems that are prepared to not only prevent health emergencies, but where is needed also to prepare and respond to them effectively. And today's webinar is all about then how do we begin at the communities, how do we link to ensure that the communities are protected as best possible, especially where we have vulnerable populations. So I thank you both for your leadership and thank you for your opening remarks. We are now going to go to Dr. Kai von Harbu from the World Health Organization, who will present to us around the overview and the implementation of community protection in the health emergency preparedness and response framework. Thank you, Kai, over to you.
Yeah, thank you very much, Sadaf. And first of all, thanks to IANPHI for jointly organizing this webinar with us. Thank you so much for Duncan and Nedret for these really great opening remarks, framing the discussion really, really well. And of course, also thanks to our partners, UKHSA, RKI, and Jordan CDC, who we will hear a bit more from on the role of national public health agencies in community protection. And I will now give a very brief introduction and an update on our work here at WHO headquarters around establishing and advancing community protection within health emergency management. Before we then go into more detail on the specific roles of NPHIs in this. And next slide, please. And as was mentioned before, my name is Dr. Kai von Harbu. I'm the unit head for community readiness and resilience here in WHO headquarters. And this is a unit that is responsible for the community protection subsystem of the HEPA framework, the Health Emergency Prevention, Preparedness, Response and Resilience framework, which is our kind of structuring of the global architecture for health emergency management here in WHO, and of course has been built as a lesson learned in particular from the COVID pandemic, but also many other emergencies. And as Nedret has mentioned already, now we are including community protection as one of the 5 subsystems at equal kind of importance as collaborative surveillance, emergency coordination, clinical care, and access to countermeasures. And that really shows how much importance we now give to the role of communities, because of course, ultimately, this is the essence of all that we are doing at WHO and all what national public health agencies are doing. In the end, it matters what the last mile, the implementation, and what reaches the community level. And of course, there are many lessons learned from COVID that I can speak a bit more on, where we have success stories, and also where I think where we learned important lessons on what to improve in the future, on engaging communities earlier in the decision-making process, etc. Next slide. And as Nedret has mentioned already, we have published our Defining Community Protection kind of vision paper together with UNICEF and IFRC, who are our key partners in this overall initiative. And within there, we are defining these 3 objectives that I will speak very briefly on to achieve community-centered approaches in health emergency management. And the first one, I think most of us are familiar with: risk communication, community engagement, and infodemic management, which we have brought together into one team here in WHO headquarters. It's about meaningful engagement with communities, informing them and enabling them to make informed decisions, and engaging them in decision-making processes, because we know that that's the key to build trust in a sustainable way, and also to ensure acceptance and uptake of public health advice and recommendations. And that's, I think, one of the key roles and responsibilities of national public health agencies as well. And we have a second objective that is focusing on population and environmental public health interventions. And here we focus in particular on strengthening community capacities. And of course, a key entry point and a key link between the health system and the community is the community workforce, the community health workers in particular. So that's where we put a lot of emphasis on enabling communities to do what they do anyway, which is the majority of the response work. They are always the first to respond, and also the last, really, that are still present when the international system, for example, has already moved to the next emergency. So we want to establish more predictable and institutionalized capacity at the community level. And of course, that also there's a strong role for national public health agencies to play, in particular in the technical support, in the capacity development, etc. And then the third objective is we call multi-sectoral action for social and economic protection. And that's really about the partnerships, about multi-sectoral coordination. Many of these aspects are very central to national public health agencies as well, and we will talk about those a little bit further. It is in particular around, or based on, the lesson learned that many vulnerable communities have socioeconomic priorities that they have to consider when deciding about following health advice in health emergencies. And that is, of course, something we have seen in COVID, but also in many other emergencies. And there we work very closely with key partners like, again, UNICEF, but also World Bank, UNDP, and others. Next slide. And I think it's always useful to look at preparedness measure through the response lens. And community protection is now applied for the first time in the response to an emergency in the MPOX FAKE here at WHO headquarters, where our incident management system is structured around the 5 C's that I mentioned before. So we as community protection are covering a cluster in that response coordination mechanism in collaboration with our HIV STI program. And we have put together this, what you see here, as a package of interventions across the key domains within community protection. I won't be able to go into detail on those. Of course, RCCE and infodemic management is a backbone of the response. Behavior change remains the key intervention to address the MPOX response, as we have seen in the previous FAKE, where it was the success factor. But there are many, community protection goes well beyond that. It focuses on community service delivery. Again, the role of community health workers is very important there, but also animal to human transmission, community IPC and WASH, public health and social measures where public health agencies have a very important role, as well as points of entry and mass gatherings and others. Next slide. And again, this is just an example of what we're doing in the mpox response in DRC, where we developed an integrated package of interventions at the community level, where we train community health workers around these 4 key domains that you see here on the slide. And we engage closely with civil society organizations and community-based organizations to deliver these key interventions through an integrated approach. And this is really the first time we are doing that, of course, focusing in particular on specific vulnerable groups like IDPs and refugees that are present, of course, in the camps in northern and southern Kivu, as well as on sex workers and other vulnerable groups across the country. Next slide. And this is a package of the training package that we're implementing for community health workers in the response to mpox, but we have developed this as a more sustainable approach to scale up community capacities in the preparedness phase, and to do this in a more systematic way rather than as a just-in-time immediate response measure, which is, of course, which we are supporting and is feasible, but it's not the preferred option. And so this is an integrated package that we're working on with the colleagues that are online and implementing in different countries. And I think we will hear more about it from in the later presentations. Next slide. And another key element in the mpox response and many other emergencies is the availability of data. So we are focusing here also on social behavioral data gathering to inform policymakers, response leaders, and I think it's again a very important function of national and regional public health agencies, and we have organized this meeting just 2.5 weeks ago jointly with Africa CDC in Kinshasa, where we brought together researchers and policymakers to discuss the mpox response and social and behavioral evidence around vulnerabilities, transmission factors, etc. in the response. Next slide. And what I think you will hear more from other speakers is that we also have developed a package to operationalize community protection more comprehensively at the country level, where we support countries in reviewing what are the mechanisms and capacities in place across at the national level, the subnational and the community level. And we are taking here a real participatory approach where we invite community members to have a seat at the table and discuss and really reflect on what are the actual mechanisms that reach the community, to have a kind of reality check together with subnational and national authorities and international partners. So this is a scenario-based exercise where we use a particular emergency that is relevant to the risk profile, and then go through all the stages of an emergency to sense check what is in place and what needs to be strengthened. So this is for countries that want to take a more comprehensive approach. And again, I think we will hear about this example from colleagues that have conducted this exercise with our support. Next slide. And I think this is really a matrix approach. We will share the slides afterwards and you can go into more detail, but these are really the key functions across the 3 objectives of the HEPA Community Protection Framework and across the different phases of the emergency management cycle. And all of these we look at in this workshop that we are conducting. Next slide. And I think this is my last slide. So it's important that as Nedret has mentioned already, we are not, no agency can do this alone, and we are not alone in this. In particular, at the community level, the number of stakeholders is unlimited, and we have very important partners that are very active on this, and there are a lot of coordination mechanisms that are established already. So we don't want to add or replace them. but we want to bring more coherence to this. So, and for us, advocacy at the highest level is very important for this community-centered approach. That's why it is so important to have very senior spokespersons that are really advocating for us. And Nidred and our executive director, Mike Ryan, are very important kind of champions of this for us. So we have a number of events already throughout the year, and it's great to add this very important event to this timeline as well. Next slide. And of course, we are also contributing to our WHO's Health Emergency Program NPHI Strengthening Initiative, where we really look at the role of national public health agencies overall in emergency preparedness and response, and where a global framework is being developed. And we look, of course, and review this approach through the community protection lens in collaboration with all our partners. We have really looked at what are the key functions that are important for national public health agencies to support this community-centered approach. I don't think I can go into detail on all of this now, but we will share these slides with you. And of course, in the Q&A session, we will talk a bit more on what are the particular roles of NPHIs that are important around supporting community protection. And I think this is my last slide. So thank you very much. I hope I didn't go over too much over my allocated time, and I look forward to the discussions.
Thank you, Kai. That was perfect, really on time, and it is really fantastic set of slides as well. What I'm really impressed by, because I know the framework was published, I think, in September time, when it was finalized, and how quickly you have actually mobilized and taking that framework into country context in terms of learning and applying some of that framework. So that's quite good to see. And I can see very quickly a comment in the chat box from Dan Martin, which is saying, this is so vitally important. I hope we can learn to see community engagement as an indispensable feedback loop to guide response activities and leadership. And I also hope from my side that some of this learning is developed into case studies that will then be available through the WHO that we can share to develop those communities of shared learning and practice as well. So thank you so much, Kai. And obviously there'll be opportunities to talk a bit more about this in the Q&A session. Now, moving ahead, I would like to now invite Zaneb Alwash from the Robert Koch Institute, Germany, for her presentation, which is around the collaboration with WHO to implement community protection in the World Health Summit. So Zaneb, please go ahead.
Thank you very much, Sadaf. Yeah, my name is Zainab Alwash, and I am from the International Protection Unit at the Robert Koch Institute. And also from my side, I thank you for inviting RKI to this important webinar. I will be presenting, as mentioned, on our collaboration with CRR, but not only on VHS. I will expand a bit about why we see this collaboration important. And I will highlight some practical examples focusing on the World Health Summit event and other activities. And then I will move forward to, with the last point, is to connect it together with the GORN strategy and how we see the linkage there. So next slide, please. As mentioned, we will start with the rationale. Next slide, please. It's very, of course, the RKI recognizes the importance of this community protection as a basis of our activity and to integrate it in our role as NPHA. The linkage specifically, we see it in surveillance and early warning systems, for example. So NPHIs, as we know, typically manage national health surveillance system, which monitor disease outbreaks and emerging health threats. So these surveillance systems, they help detect and respond to health risks early and promptly. So by enhancing these local data collection and analysis, we can empower communities further to become more proactive in responding to health threats. NPHIs should work closely, in our opinion, together with local health authorities to ensure that data collection is done promptly. Secondly, we see this connection also on preparedness and response. So NPHIs are critical in emergency preparedness, providing guidance on how to respond to pandemics and natural disasters or other health emergencies, actually. So we can collaborate with local governments and health systems to create more effective response, which protects communities. Strengthening community resilience requires, of course, as well, building local capacity to handle these emergencies and to also develop community-based disaster response plans and to help in building these strategy plans. Last but not least, the policy development and advocacy. So NPHIs can collaborate further directly with community leaders to ensure that these policies that we are talking about are culturally appropriate, they meet specific needs of the population and are tailored to local contexts. So by providing resources for community engagement, NPHIs can ensure policies are effectively implemented at the grassroots level. Next slide, please. So to move forward to collaboration and collaboration with community readiness and resilience examples. Next slide, please. I would like to mention, first of all, the World Health Summit event, as mentioned. So during the World Health Summit, which took place in Berlin in October this year, we collaborated together and as RKI, we organized this event, which is called Strengthening Community Protection, Community-Centered Preparedness, Response and Resilience for Public Health Emergencies. So a group of major stakeholders for community-centered preparedness, response and resilience for public health met together at this event, and it fostered an important discussion. There were many very important discussions which focused mostly on 6 key points, and I tried my best to summarize them here. So to start with, first of all, public health emergencies. It was highlighted that public health emergencies are becoming more and more complex due to multiple factors like armed conflicts, climate change, human, animal, environmental shifts. But local and community-led responses are under-recognized in broader strategies. So empowering local communities, which is the next point, empowering local communities to participate in the decision-making process is actually crucial. It will help in improving the health and well-being during emergencies, and it requires inclusive governments and fair resource distribution. So we need to engage community groups and integrate them further within formal health systems. So community-based groups, civil society organizations, of course, they need to be involved further in preparedness and response activities. Furthermore, these interventions that we are mentioning, they need to respect local context, of course, and which is even more reasons to involve communities in the process. We need to also integrate community-led preparedness into national policies, which is also again here highlighting the importance of NPHIs in the process. Last but not least, it was concluded and agreed upon during this discussion among all stakeholders that it is important and useful to establish a global partnership together to support these priorities. Next slide, please. So the second example that I have from our collaboration with CRR from last year is the Community Protection National Strategy Workshop, which was, of course, implemented together with WHO, CRR, and also with the 3 levels, actually, of WHO, and the Ministry of Health in Jordan and Jordan CDC. So we supported the process of implementing this strategy workshop. RKI played an active role in the collaborative planning, preparation processes for this national workshop to take place, contributing with expertise and resources in order to ensure that it is designed to meet the needs of the local stakeholders. We provided also technical support in the adaptation and contextualization of the tabletop exercise. and we supported the implementation process as well during the workshop. So the workshop itself was 5 days, or actually 4 days, and we were there to support also with the lead facilitation and the evaluation processes as well, which you will hear more about actually from JCDC shortly. The aim of this exercise was to reach a strategic planning which highlights the importance. Sorry? Okay. So the aim of the workshop is to reach a strategic plan which highlights what are the needs and what are the capacity development needs which can be done in the future, and what are the important operational activities that should be supported in future term. So here you see some snapshots actually from the tabletop exercise which was created, which is a scenario that was done with a few communities, and there were of course members of the community sitting there in the workshop during the whole time in order to discuss together, in the case of this scenario, what should be done, what is available, and accordingly a strategic plan will be drafted based on that. In addition to these two activities, we are also planning other activities with CRR as well. We have future workshops planned for 2025 or for the near future, in addition to other community protection related events that will take place in Berlin. But I cannot disclose them in more details yet. It's going to be shared later on. Next slide, please. Now I would like to show the connection that we see with community protection, CRR, and the GORN community-centered approach and the importance of this. So I also work in the GORN Collaborating Center, or GORN CC, in the RKI, and which is why I would love to show you here the connection that we see, or the linkage to the GORN strategy. Next slide, please. So, thank you. So here, as you can see, I have also adapted partially from the community RR strategy, which was shared earlier by Kai. Thank you. And here I would like to mention that the new GORN strategy, or the latest GORN strategy from the year 22 to 26, actually emphasizes on community-centered approach. So it's integrating this theme as a foundational concept which should be used, or should be the basis across all areas of GORN's work, so across a sectional concept. So we are, as RKI, we're still trying, or still in the brainstorming phase, let's say, and in discussion, of course, with GORN operational support team and other partners, in order to find ways to make this more implemented in, let's say, in the field and in reality. For example, we have a few examples which are still, which are currently in discussion, let's say. The first one is to strengthen capacity through operational research. So, for example, conducting a scoping review on tools and approaches to engage communities during emergencies in order to increase the localization of response. Second of all, to build capacities, or through building and capacities and training, we can, for example, incorporate the community-centered approach, incorporate it into modules of for example, community protection and engagement into the GORN existing training programs. For example, the leadership training. The leadership training takes a few days, and it's done in a modular, let's say, style, and in a module for community engagement can also be added to support the community protection aspect furthermore. Third, you also see integrating community engagement principles during outbreak response as well. For example, enhancing tabletop exercises in the rapid response mobile lab simulation exercise by including a case study or case studies focused on community engagement and risk communication to show to highlight its importance further. I think that's my last slide. Yeah, thank you very much.
Thank you very much, Zainab. I think what is striking, and this was part of the discussion also at the World Health Summit side panel meeting, was that we can't do this alone. So we all have to work together, different sectors. It's not just National Public Health Institutes, but it's all the other sectors as well. It's the community groups. It's also across the health and non-health sectors. We're moving towards an all hazards approach that have to collaborate and work in partnership. And I think you've given a very good example. We will be talking, the next speaker will be talking about how Jordan is now thinking around the application of this, but it's good to see it from a National Public Health Institute perspective, so people can start thinking. And work has already been done. And in the chat, we also have a link from Colombia. Carlos has put a link in there around the work that they're doing on community-based epidemiological surveillance network that they have established. So there's a link there for people who want to have a look at that. But thank you very much, Zainab. That was very useful presentation. I think it puts it into context and application itself. But I'd like to move on to our next speaker, Dalia Zaid from the Jordan CDC, who will be talking about planning of a community protection approach in Jordan. Zainab? Sorry, Dalia, over to you.
Thank you very much. Today I'll be sharing with you the Jordan experience in building community protection in health emergencies. Next slide, please. So what we did basically is, as my colleague said, we thought about the core objective for Jordan, and the core objective was to empower communities to act as frontline responders in health emergencies. The strategic importance was that communities are the first and the last line of defense in health emergencies. And through community protection, we reduce the health, social, and economic impact of crises, and through enhancing local resilience and national preparedness. And within global context, the WHO, as my colleague mentioned, they emphasize the community-centered approaches. And as for Jordan context, during COVID-19 and MPOX, there was a highlighted need for stronger community engagement in Jordan. Next, please. So Jordan CDC plays a central role in national health emergency response. Our mandates include developing health policies, coordinating response, and integrating community engagement into health systems. To develop our community protection roadmap, we partnered with local stakeholders, including the Ministry of Health and the WHO and RKI. And this collaborative approach ensured that the strategy aligns with both global frameworks and local needs. Next, please. Our journey so far. I want to mention first the achievements that set the foundation. So before I go into the workshop, I want to highlight that Jordan CDC has already established a National Risk Communication Community Engagement Committee, and this was after the COVID-19. And this is co-chaired with the Jordanian Ministry of Health, and it has an established terms of reference. We also developed RCCE plans during COVID-19 and MPOX outbreaks, and initiated the integration of RCCE in national preparedness plans. So there was already a paved road, let's say. And in partnership with the stakeholders, we did the workshop. And the workshop is to initiate a context-specific community protection roadmap. Activities included introducing principles of community protection to all participants, conducting a tabletop exercise, simulating a zoonotic disease outbreak, and identifying gaps and prioritized actions for strategic roadmap. Next, please. So we have identified some gaps in the workshop that I would like to highlight a few. So RCCE was often perceived as a secondary priority with limited integration into emergency frameworks. Community health committees lacked clear roles and standardized protocols for surveillance. We also identified a need for better tools to manage misinformation and gather community feedback. So the workshop helped us identify areas for immediate improvement, such as governance, coordination, and capacity building. Next, please. The prioritized actions, as I mentioned, is to strengthen governance with RCCE as the core of emergency planning, improve coordination through formalized protocols and SOPs, this was very important, and build local capacity with structured and continuous or sustained training initiatives. The best practice I would like to share with you is that we noted the engagement of communities early in the planning and response phases was very important. Foster trust through transparent risk communication and inclusive community engagement, and of course, document lessons to refine strategies and build evidence. So next, please. So the roadmap for community protection in the short term, we wanted, I will go into a little bit of detail here. So we wanted to validate the roadmap through inclusive multi-sectoral consultations and pilot testing in selected communities, finalize and refine the strategy based on stakeholder feedback and consultations and pilot testing, and conduct targeted training for community health volunteers to enhance community-based surveillance and RCCE capacities. And in the medium term, we want to establish institutionalized RCCE platforms and create digital and community-based tools for social listening and managing infodemics. We also want to operationalize multi-sectoral collaboration mechanisms through defined roles, responsibilities, and resource sharing agreements. And for the long term, we want to integrate community protection principles into national health policies, strategies, and legislative framework. And finally, advocate for sustained finance and capacity building initiatives to strengthen community health systems and RCCE activities. Next, please. So how we wanted to leverage community engagement, reflecting on past experiences, as I mentioned during COVID-19, we used RCCE effectively to promote behavior change and build trust. And our impacts response strengthened local partnerships, showcasing the value of engaging communities early in the planning response. And finally, the workshop brought together over 60 participants from various sectors, aligning efforts and ensuring that community voices are central to our strategy. Next, please. The reflection for NPHIs, aligning community protection strategies with national priorities ensure relevance and sustainability. Collaborating with international partners like WHO and RKI provides critical resource and expertise. Empowering communities as proactive partners strengthen emergency preparedness and build long-term resilience. We believe these lessons can inspire and inform other NPHIs and developing their own approaches. Next, please. So moving forward together, we remain dedicated in advancing community-centered health security with a focus on collaboration and continuous improvement. Success in community protection requires strong partnerships and finally, together we can build a resilient health system that prioritizes community protection. Thank you for the opportunity to share Jordan experiences, and we look forward to learning from your insights and working together to refine and scale community protection strategies globally. Thank you, and over to you, Sadaf.
Thank you very much, Dalia. What a fascinating presentation. Really impressed by the fact that the roadmap that was developed was with 60 participants with a multi-sectoral approach. And again, it goes towards, how important that is to ensure both vertical planning as well as horizontal planning on national, subnational, and community level is the most effective way to actually put in those community protection practices successfully. So thank you so much. That was a really great presentation. We look forward to the Q&A session as well. I'm sure people will have lots of questions to ask about your planning and implementation phase. So thank you, Dalia. I'm going to move on to Ed Newman. Ed is going to speak about the role of community structures in health emergency preparedness and response. Ed, over to you. Thank you.
Cheers. Thank you, Sadaf. Good morning, afternoon, good evening, colleagues online. Great to see such a good turnout for this important webinar. As brief, my role really here is to talk about community structures and their importance and their role in HEPA and in particularly emergency preparedness response. And as already mentioned, I'm director of the UK Public Health Rapid Support Team and also deputy chair of the Go On Steering Committee. I'm just going to, if we can just move to the next slide, spend a slide talking about what my team does and our involvement in this area particularly. The UK Public Health Rapid Support Team is a little bit unique in so much as it's a partnership between our NPHI, the UK Health Security Agency, and the London School of Hygiene and Tropical Medicine. And it's funded by UK aid money specifically to work with what we call ODA eligible countries, low middle income countries overseas, to really support effective response to infectious diseases outbreaks and public health emergencies. And in doing so, we work with a lot of our partner countries, most of them NPHIs in those partner countries with their national response. And we see that shift in everything that we do, as you'll see in a minute, towards involving communities into a much more locally focused response, which obviously we're very pleased with that direction of travel. And we'll talk about that a little bit more today. We have an integrated remit within the programme, so we can rapidly deploy public health expertise, and they're listed at the bottom of this slide, to support NPHIs, host government, Ministry of Healths, or multilateral partners like WHO and UNICEF with outbreak response, sort of in that acute phase. So we can send out technical assistance within a week or two of a request coming in, and be there for 8 weeks or so in as part of a national response. But when we're not doing that, we also do operational research to sort of further develop the evidence base for best practice. And a lot of that now is developing an evidence for where community involvement in response leads to more effective and more efficient response, and we'll see that in a second. And then our third pillar of our triple mandate is capacity strengthening, and this is really to make sure we're supporting partners, NPHIs and others in developing a local capacity for response, and that's where a lot of the work that we've been doing with colleagues online, RKI and the CRR team at WHO really comes in, and where we've been focusing a lot of our effort on community protection. So if I can just have the next slide. Just going to spend a little bit of time talking about some of the recent activities that we've been doing over the last year or so that are very much community-centred activities and sort of ground where we've been interacting with NPHI colleagues and others around bringing in and involving community groups in all that we do. So looking at the three pillars then, we're seeing an increased amount of support to response to national outbreaks being around community engagement, RCCE pillars, for example, and RCCE really taking a priority across all pillars of response, which is obviously pleasing to see. Three recent examples there. We've had deployments through Go On and also bilaterally to support South Africa with MPOX, and then Go On deployments to Marburg as well. And all of them have involved risk comms community engagement activities and specialists. So really seeing that focus coming down to engaging local communities, which we're very pleased with. 2023, 2024 for us, the majority of the support we were doing to national response was around cholera. And you can see at the bottom of that left-hand column there, we deployed over 15 members of staff, 5 different countries for cholera, and a heavy focus there on engaging the communities affected with cholera and really tailoring a lot of the public health interventions to the need of those communities and to what would work for those communities. And we had RCC pillar lead, for example, at UNICEF. We had a bilateral deployment to the Zambia National Public Health Institute there, working with their RCCE team, and also through Go On to Malawi, providing anthropology and community engagement expertise there as well. So we're seeing that happen in acute response, which is great. As I mentioned, a lot of our research is focused around building the evidence base for why should we involve community structures and community groups in response and in preparedness. And so we're doing a lot of work at the moment to really try and develop the evidence base as to how that makes response more efficient or better. The one that I've highlighted in the middle of that column is a project we're doing at the moment with Brazil and Cape Verde around using community leaders and the community groups, particularly in rural areas, as the sort of the project translates to Guardians of Health, really looking at community-based surveillance and events-based surveillance, and how trying to build an evidence base for how getting that detection and initial reporting and surveillance right out into small community groups, where, as we'll see in a minute, they're not necessarily health experts themselves, can really give you that early detection and early warning system that Zainab and others have spoken about already. And that's including, for example, use of digital technology. So this is very much about engaging communities to, in this case, report and do that community-based surveillance using a mobile phone app that's been developed. And then, as has already been mentioned in the capacity strengthening pillar, we do a lot of work with WHO colleagues. The top one there, the Ghana Community Protection tabletop exercise we did with Kai and Rim and colleagues at the start of this year, and really looking at a sort of how we exercise and understand a community's ability to respond. And Kai's already mentioned, a pathogen that's of strategic importance for that country. And this is very much a participatory approach from the sort of bottom up. So this is really where we're inviting community members to lead the discussions as to how they would respond and how they would detect in the first place an outbreak within their particular village, their particular rural community, and then using that to then inform the district and the ministry's national response. So very much a bottom-up approach. And the other thing to highlight here was some work we've done off the back of cholera outbreaks in southern and eastern Africa, particularly, where we've developed a rapid qualitative assessment tool, really a toolkit that our community engagement and anthropology advisors have sort of developed through those various outbreaks, which really looks at the ability to engage with community structures, community groups, and key opinion leaders within those communities around what their needs are during response. And this was initially developed for cholera, to really to understand the context and to inform which of the menu, if you like, of public health interventions would work best in those communities. And then we've pivoted that more recently towards MPOX, and while our RCCE team were deployed to Rwanda towards Marburg virus as well, to really sort of understand that need and advocate with National Public Health Institute partners and the national response architecture, the need to get out into the communities early, conduct that rapid qualitative assessment to understand the needs of those communities and what interventions would work best with them. Collaborators are down the right hand side, and I do need to acknowledge Rim and Kai for allowing us to partner with them to support some of this work. Zainab already referenced the go on strategic theme of being more community centered as well, and so all of this speaks to that move from the public health emergency workforce, if you like, of which we are part of through the Global Outbreak Alert and Response Network, that focus on community and community structures, which, as I say, is very pleasing to see. If we can just have the next slide. We've already heard from previous speakers around HEPA and obviously the focus on HEPA. Community protection, one of the 5 C's, yes. But I would actually argue that community structures have a role in all of the 5 C's of HEPA, if you want to call it that. In surveillance, we've talked about community surveillance. We've seen how community-based surveillance is important. And we think that's key to the early warning system, that early detection before a localized outbreak can become a broader public health emergency. But it's also key in gaining trust in the community. And so we see that with the provision of care. If we take that safe and scalable care, that is provided at the community level through the health centres, through, in many cases, volunteer health community workers. And doing so and providing that and engaging with those those structures develops trust in the local community. These are people the local community know and turn to for their care. And so the community structures that are already in place in a country below that national level, down at a local level, are so key. Same with access to countermeasures. And we don't need to rehearse here some of the supply chain issues that we've had with vaccines and delivery of vaccines, and also some of the vaccine hesitancy that we see when we're trying to vaccinate during response, for example, to Mpox, to Ebola, to Marburg. And again, having that community level contextual understanding of what will work in the community is so key. And that's where community groups and community structures can really play a key part in delivering those responses in a timely fashion. And again, emergency coordination. Well, we're pleased to see that RCCE is now becoming part of every national response. And it's really key to give those local communities a voice in that coordination, to really understand what the communities are doing and what works in those communities in terms of interventions, and to feed that back up into incident management team structures, for example, because that then really advocates for the right type of intervention in each community. If we can just move on to the next slide. This slide was presented previously at one of the EpiWin presentations we did with WHO colleagues, both the CRR team and AFRO. And what I wanted to draw attention to here really is those boxes along the bottom that below local health authority or below local government, call it what you will in your country, community structures that we see as so important to the work that we do. So we're not just talking about community health workers and community health volunteers. You'll see they're down as one of a range of half a dozen boxes along the bottom there. I think it's really key to think outside of just that structure going down to the local level. We're talking about a wider workforce, if you like, that can provide that response and also feed into preparedness. So we're talking about the community stakeholders and volunteers, non-government actors, civil society, yes, but also voices for affected communities is so key. And that can come from, for example, religious groups. Particularly, we were trying to focus on aspects of society, communities that are perhaps underrepresented, even at a local health authority level, and that might be slightly marginalised during response, because those vulnerable parts of society are often the ones which are most affected by outbreaks at a local level. So one of the key things we do with our rapid qualitative assessment tools, for example, is really identify who we need to speak to that can represent marginalised populations and vulnerable groups in society. And as I said before, that can come through religious leaders, it could come through, for example, traditional healthcare backing, can come through education services, through schools, through social groups quite often, as well as the more formal community health workers and community health volunteers. And I think the red box on that slide that's so key is that community-centred approach. So really working together to co-create with the local authority what good readiness looks like in that community, and appreciating that readiness will be different for different communities. Getting that sort of contextual feedback in early, back up to the primary healthcare systems, back up to the local health authority, is key in making the response when it comes as efficient as it can be. If we can just move on to the last slide. I think really wanted to highlight the importance, and we've talked about it here. It's easy being the last presenter today because so much of this has already been talked about. But that rapid response, that early warning in the community is key to preventing a localized outbreak becoming a bigger public health emergency. And so that is therefore in the interests of the national response and the NPHIs involving in that response. And having those community structures and those community members being able to quickly detect and report themselves, but also to locally implement public health interventions, can make or break those initial first days of outbreak response. We mentioned involving community during the start. We've seen some really good examples of where we've done that during the preparedness phase and are rolling that out. So the work that the RKI and ourselves are doing with Kai's group, with a CRR group in WHO, to really involve community groups in the planning with their national public health institutes, with their ministries of health, gets better buy-in and trust from the communities. But as we've heard all the way through, it also makes sure that the response is contextually appropriate to the communities that are affected. We mentioned about surveillance, but also community-led interventions are key. And I used the term comply in that third bullet point. And deliberately, contentiously, in inverted commas, it's not what we want. What we want is public health interventions that are appropriate and that work. And I think what we're trying to say there is that public health interventions are far more likely to work if we involve those local community structures from the start in the preparedness, in the planning, involve them in that planning cycle. And then finally, I mentioned giving a voice to overlooked communities, as I said on the previous slide. It's to look beyond just your local outposts, your local government, local healthcare, and the primary healthcare network, but into other stakeholders, the NGO community, charity groups, social groups, religious leaders, etc., to make sure that we're not overlooking the populations that might find it the most challenging to adopt a particular intervention, or that might be where response is most likely to happen. And we see that in a lot of the work that we do, engaging with artisan miners, for example, or bushmeat hunters in the case of viral hemorrhagic fever outbreaks. And those are the sorts of communities that we really want to engage and say, what sort of intervention would work for you? What do we need to know the most from your community? And I think that's where the strength of engaging those communities early on can really come to its own. I think that's me in terms of time, so I'll leave it there, but looking forward to the discussions later. Thank you, Sadaf, and back to you.
Thank you, Ed. Really comprehensive, very great presentation. What really struck me is around what you were calling about developing those trust relationships and how important they are. And another point that you made was around, looking beyond the traditional community partnerships, and what is really required to that is a exercise of mapping so that we don't miss out on any vital community groups, especially those who represent vulnerable populations. But what was really driven home to me around the roles of national public health institutes and other partners as well is that we can't wait for an emergency to be able to start engaging with those communities and those populations. So this is a process that should be ongoing and should be sustained as well in terms of maintaining those partnerships and those networks. Only then can we effectively co-create the kind of interventions that will have the most impact in a health emergency situation. So thank you very much for all your work and for your presentation. I'm now going to move on to the Q&A session, which will be led by Dr. Kwang. So Rim, if you could just move ahead with the question and answer session, I'd appreciate that. Thank you.
Thank you very much, Sadaf, and for giving me floor. As Sadaf already introduced, my name is Kwang Il Lim. Just call me Lim. I'm the Community Readiness Resilience Unit in Country Readiness Strengthening Department of WHS Emergency Program in Geneva. So I'm happy to moderate this question and answer sessions. So far, our panelists made excellent presentation. It's a really amazing presentation. Already talking a lot about how to implement the community protection of HEPA in country context. A lot of good examples. So what I'll do is that, first of all, I will ask one or two questions to each panel member. At the same time, participants also can ask if there is any question, and also can put questions in the chat box as well. So we have around 20 minutes. So I hope that each panel member to speak 2 or 3 minutes maximum, so that we can have some time for discussion later. So first question to go to Kai from WHO side. Thank you very much again, Kai, for really introducing the overview of the HEPA community protection and also important activities going on at the country level. I think this really highlights the importance of community protection and also how national public health agency can implement those activities in the country level. So as you rightly mentioned that HEPA community protection, which is a great initiative. In addition to that initiative, there are also other global very good initiatives. However, national public agencies and health agencies for health working for health system have to prioritize given their resources and capacity. Obviously, some of the initiatives overlap to some extent, and also some are not really well coordinated, which lead to those organizations like NPHI as stretching from responding to those similar priorities. So from WHO perspective, what do you think potential solution to really mitigate those challenges and also overcome those challenges? Hope my question is clear. Over to Kai.
Yeah, thank you very much, Rim. I think the question is very clear, and I think it's an issue that we acknowledge and we are really aware of, and we really try to address systematically in the way we are working. Of course, there are many initiatives these days, and they really compete for the national resources, for the time commitment by the representatives, our counterparts, and there are some overlaps as well. And I think some of the ways we try to address this is to, as I mentioned in my presentation earlier, we are not building new coordination platforms, for example. We try to build on existing mechanisms that are in place, and many were mentioned today as well. Also, for example, the strong collaboration we have with GORN on many of these activities. So it's important to find synergies and build and use existing structures. That's our approach instead of building a new vertical mechanism. So I think that's a very important approach. Another one is events like this. So regular exchange discussions among stakeholders. That really helps to identify overlaps and also to harmonize strategies and approaches. So I think that's another very important strategy, and that should also, of course, happen at the national level and subnational level. Another one is that we really want to give the member states the lead role in this initiative and in the discussion. So we want ministries of health and NPHIs to take the lead in setting priorities, and we listen to them, and then aligning external initiatives to the priorities in the country, and we can support them in mechanisms like the workshops we have mentioned. But also, I think we are well aware of the role of the national and the regional counterparts, and we follow the lead. So if a country has a very specific technical need that they express to us for support, then we are supporting them in that. If they want to take a more comprehensive approach, then we have a methodology to support them in that and facilitate discussions and also prioritization in a systematic way. And then another important aspect, I think, is to promote integrated and cross-sectoral approaches. So again, not to have a standalone health sector initiative, but involve other sectors and their work and their mechanisms that they have also around community engagement. So that's also, of course, what we are really promoting and advocating in our work, in all our events that we are doing, and also in when we are supporting country level activities. And then a very important one is, I think, that we also have to advocate for flexibility when it comes to the financing, because financing and the funding from donors, etc., is often very vertical and tied to very specific disease-specific actions, etc. And that's really what is our role as well at the global level, to promote a flexible approach there and a more cross-cutting approach, prioritizing through collaborative frameworks like the community protection and the HEPA framework, for example. I think that is really, really important as well. And then the last one, we heard so much about the importance of community engagement and the community feedback mechanisms. And I think it's the same here. So communities are often the ones that notice those kind of abundance of parallel activities the most. So the feedback mechanism with communities, and for example, what we have established here for the mpox response, an informal community advisory group, where we really seek guidance and advice on priorities from representatives from community-based organizations. So these mechanisms are really important to identify overlapping priorities with different initiatives, etc., that we may not even be aware of. So these are some of the ways that I think this very important issue can be addressed. And I think national public health agencies are very well positioned to play this coordinating role and identify those competing mechanisms, also opportunities to address those in a most coordinated way. Thank you, and back to you.
Thank you very much, Kai. I think your answer is very comprehensive. I think you highlight already a very important point in terms of systematic engagement of community and also utilize existing structure. I think that's the key. And also how we bring the national authority health authority like Minister of Health in the picture so that we can really prioritize the actions and also capacity building for community level, and also importance of multi-sectoral action and also cross-sectoral action. I think these are the key important issue, and also listening actively from the community and also providing timely feedback to community. I think that's extremely important. So I think that you already highlight importance of national public agency in really implementing those community protection action as a priority. I think this is really linked to my next question to Dalia, who is really doing country action at the country level as one of the important national public agency stationed in Jordan. So probably my question go to Dalia next. Dalia, I think we really enjoyed working very closely with you in Jordan. Already previous speakers mentioned a lot about how we collaborate together with RKI and Jordan to really develop national community protection activity in Jordan. So as you rightly presented that the role of Jordan CDC was very important in our joint activity. Therefore, what is the kind of guidance that in terms of roles and responsibility of national public health agencies like Jordan CDC in terms of implementing community protection action within national health emergency coordination and management system? I think this is one of the key things that we can learn from your side. And also if you can guide us, what are the key roles and responsibilities that national public agency can play? Over to you, Dalia.
Thank you, Rem. So basically, NPHIs are very crucial in integrating community protection into national health emergency system. So from our brief experience, let's call it, their responsibilities include, of course, the strategic leadership. So to develop policies that prioritize community protection and preparedness and response, and to advocate for its inclusion in the national health security framework. So this is regarding the strategic leadership. But in addition, we also need to focus on capacity building. So train community health workers in surveillance, in risk communication, and emergency response. Also provide practical tools and protocols for local level engagement. In addition to risk communication and community engagement integration. Through the institutionalization of risk communication as part of emergency plans, building public trust and combating misinformation, empowering communities to take active roles in planning and response efforts through inclusive engagement. And finally, through collaboration and sustainability, so to coordinate multi-sectoral efforts to align local and national actions, and to secure resources and evaluate initiatives for long-term impact. And this was something that we highlighted during the workshop, is how we can have resources, how we can have them sustainable, how we can advocate for the long-term savings that we would do in the community engagement and community protection. So in summaries, national public health institutes must act as both technical leaders and facilitators of collaboration to integrate community protection into emergency systems. By doing so, they ensure communities are empowered as active participants in building resilient health systems. Over to you, Rem.
Thank you very much, Dalia. I think the experience that we have together with Jordan C is really crucial. We also learn a lot while we are implementing this activity in Jordan CDC. I think you already highlighted this leadership role as well as technical leadership role, as well as how this navigate this community protection component into national framework for health emergency preparedness response. I think that was one of the key lessons that we also learned, and also capacity building part. Obviously, your agency is involved a lot on these training activities and developing tools and guides, etc., which is already existing well. But how that component coming into community protection action, I think that was something that we really learned, and also we work together to develop national community protection strategic action plan in Jordan context. So that's going to be very important example, and also way forward. We really looking forward to continue to working with you together with the Ministry of Health Jordan to really implement this national community protection strategic plan in Jordan context. Thank you very much again.
There are a couple of questions in the chat box. Could we address those first before moving on to any other questions from the panel? Is that okay?
Sure, absolutely, yeah.
So we have a question from Carlos Correa, which is about, in this topic of participation of our communities, what lessons have been learned and possible recommendations, considering their cosmovision, like indigenous cosmovision, ancestral knowledge, traditional medicine, and approach to public health issues. And I'd like to ask Ed if he would possibly answer this question.
Yeah, happy to, Sadaf. I just sort of picked this out as a real world sort of lesson that we saw last year in the importance of engaging with, in this case, it was religious communities and religious leaders, but also where that religion starts to impact on traditional medicine and the use of traditional medicine versus what we would call the more sort of modern medicine and interventions. And this goes back to some deployments we had our community engagement experts and social science team in Malawi on. So we're deploying through GOAN to provide anthropology support to the national response, but also deploying public health expertise to the UK emergency medical team, where they were running a cholera treatment centre in Malawi, and able to go out to the local communities. And it really highlights the importance of engaging, as we said before, not just the sort of modern health column as it goes down into those local communities, but in this case, engaging with religious leaders and traditional providers of traditional medicine, which a lot of the rural communities in Malawi were turning to. And the example was around, and the lesson identified really was around water purification during the cholera outbreak, and really advocating for the use of water purification countermeasures that were being issued by WHO and UNICEF and others on the ground. And what we discovered from that interaction with those religious leaders is that there was a hesitancy to use the main water purification product that was being pushed out. Quite simply, it was a tablet that was added to water to purify the water. And because of its formulation, because it was a white tablet that needed to be added to drinking water, the local community, based on their religious beliefs and their traditional medicine, were reluctant to use what looked like an undefined white tablet. It was against their culture in those water purification systems, and that was why there was a hesitancy to use that. A very similar product was available, which had, for all intents and purposes, the same active ingredients, but was formulated as a clear liquid, and so was very much more addition of a watery-like substance to drinking water, which did the same job and had the same outcome. And we sort of suggested this to community leaders, the team that were deployed on the ground at the time, as an alternative, and that they said that yes, that would absolutely comply with their religious beliefs and their traditional medicine. And so we very quickly recommended, well, actually, rather than using this solid tablet-based formulation, if we can provide the liquid water purification system, the uptake in that particular community would be much higher, and so it was. So that's, to me, a granular detail, but actually a really good example of where engaging outside of the health structure those communities made a really tangible difference to that particular community. They were able to find a way that they could purify their water that was acceptable to their belief system and their traditional medicine, but still had the net result of purified drinking water, which is what we were trying to achieve during a cholera outbreak. So I think that's one of those lessons learned where we can really say this is where this makes a difference and makes a difference to your public health interventions. And sometimes it's a really simple change, the formulation of a product that can make all the difference.
Thank you. There's another question. Rim, can I quickly ask that one as well?
Yeah, thank you very much. I think that is very relevant question. Basically, Ed also may explain on that, but in Ghana, basically we used the assessment tool. We, together with UK Public Health Response Team, which is the Ed team, we developed kind of community readiness checklist. Basically, that checklist can be used as a self-assessment tool, or we can really work together with the community members and district level and national level to assess whether communities are having in place in terms of mechanisms and capacity to only detect and respond. We developed question and also put it as a checklist, and then we used that checklist during the simulation exercise, which we did in Ghana together with the UK team. It was really helpful for community members and also local public health team to understand what are the key functions and capability needed to build in communities, how that should be connected with primary healthcare and local health system. I think that was very useful. Then at the end, after using this assessment tool, we'll be able to identify the gap in terms of mechanisms, capacity that needs to happen at the community level. So we are still trying to finalize that checklist based on the lesson learned from the Ghana and also other countries, because every community is different. So we cannot use one specific tool for all the community. Therefore, there needs to be some process and also time to really contextualize those assessment questions to the specific community context, which firstly we work together with the national and local level to really work together with the communities. Over to you.
Thank you, Rim. So Ed, I think Rim was answering in response to a question that was posed by Meng from who's the chair of IANPHI's Pandemic Preparedness Thematic Committee, asking whether there is a toolkit available for National Public Health Institutes to use as a self-assessment tool to assess the state of readiness and response. And Meng, I hope that answered your question. Rim, back to you. We can take a couple of more minutes before we close the webinar. Thank you.
Probably, that's true. Time is already 3:30. Then I will first of all give very quickly to Jainab, because Jainab already explained the several activities that you conducted together with us. So quickly, from your experience, that Jainab, what are the key areas that you really think that the National Public Institute really mandate in accordance with your mandate to implement this community protection at national and also sub-national level? Any quick guidance? Just 1 or 2 minutes, quickly. Over to you.
Thank you, Rim. Yeah, I'll keep that short. Actually, I see many key areas which link with the National Public Health Agency's mandates to integrate community protection. So, as mentioned earlier, I'll highlight them again. We have the mandate of surveillance, and accordingly, I see the high importance of focusing on community-based surveillance, which can be further strengthened in the community, since, as we know, outbreaks begin and end in communities, and this is how we can support the process further and improve preparedness. We can support as well in capacity strengthening, as mentioned. Strengthening local capacity through trainings and resources is vital. Also ensure coordination between local and national international health systems, which NPHIs can help with. Also making sure that there is a cross-sectional community protection, let's say, aspect in our project activities where relevant, and making sure that we have a localized aspect in it. Last but not least, also conducting standardized needs assessment, as also mentioned earlier. It is very necessary indeed in order to know and enhance overall health emergency management and what is available and know the gaps. Over to you, Rim. I hope that helps.
Thank you so much. I think time is already up. So we have had a lot of this good discussion. Probably we can find another time to have more deep dive and more discussion. So probably we close this question and answer session. Over to you, Sada.
Thank you very much. As you said, Rim, really, really interesting set of presentations, and thank you for facilitating a fantastic Q&A session as well. We're just going to close the webinar, and I would like to just invite Kai for some closing remarks, please. Kai.
Yeah, thank you. Thank you very much, Sadaf. And thank you, Rim, also for facilitating this this great Q&A session. There are lots more questions that we could discuss. And I shared a few links in the chat, including to our unit's website, where you can find a few more resources. And we are available, of course, through Sadaf as well, to discuss direct support to any of you in activities you would like to initiate at the country level. But I think it was a very useful discussion. I learned a lot on really the critical role of national public health agencies in operationalizing community protection. There are a lot of aspects to it. We heard a lot on very practical examples from the country level. So thank you very much to the speakers, to the panelists who shared examples from Jordan and Ghana in particular. Thank you to UKHSA, Robert Koch Institute, and Jordan CDC for sharing their experience. I think, as Nedret mentioned, this is an initiative that is not, that was started only about 2 years ago with the HEPA framework, and I think we've come a long way already. But there's a lot more that needs to be done. And we see national public health agencies, and in particular IANPHI, of course, as a key ally and a key partner for us. We have all very complementary mandates and roles that all can come together to advance this community-centered approach to health emergency management. So I hope that I hope that some aspects were highlighted and were useful for the participants today. But there's a lot more to share. There's a lot more ideas and experiences that we can exchange. So I think from WHO side, we hope that this is just the start of a conversation that we can have on advancing this very, very important topic. And that's why finally I want to thank, of course, IANPHI for organizing this event and jointly with us preparing and conducting it. I think thank you very much, Sadaf, for the excellent collaboration on this that I hope will continue further. And also, of course, thank you to Duncan for the great leadership. So with that, I hope I look forward to continued collaboration to advance community protection together. Back to you, Sadaf.
Thank you, and thank you to the WHO for co-hosting this. Thank you for the IANPHI Secretariat, in particular Raphael Ismaili from the Secretariat, in organizing all the technical aspects and this webinar. I would like to also thank the speakers for generously giving up their time to prepare and present. And we look forward to working with you and our National Public Health Institutes in strengthening the roles and functions, especially in relation to community protection. And most of all, thank you to the participants for giving up your time to attend this webinar. And we look forward to future webinars on the same subject as we progress and move forward with this work. So with that, good morning, good evening. Hope you have a lovely day. Thank you. Bye-bye.
Bye, everybody.
Bye.